TAXINOMISIS, a multidisciplinary approach for the stratification of patients with carotid artery disease. TAXINOMISIS is a research project funded by the European Commission. It aims to revolutionize the approach to patient stratification in carotid artery disease. TAXINOMISIS approach considers clinical and personalized data, plaque and cerebral image processing, computational modeling, and novel biomarkers. The main outcomes of the TAXINOMISIS project are a powerful risk stratification tool and an innovative lab on a chip.
TAXINOMISIS project is an innovative multidisciplinary project for the risk stratification, assessment and support of treatment of the carotid artery disease. Taxinomisis is a Greek word that means in English stratification. And of course, the project provides tools for the risk stratification of the disease, the assessment of the progression, and of course the support of treatment. In that way, we believe that we can offer a lot to patients suffering from the disease.
The clinical practice in carotid artery disease is driven by the European Society for Vascular Surgery guidelines. These guidelines have specific gaps. They often fall short in terms of predictive accuracy and comprehensiveness. They rarely cater to the individual characteristics of each patient. They do not recommend screening of asymptomatic patients. By studying longitudinal carotid artery disease cohorts, a major shift in the underlying pathology of symptomatic, causing transient ischemic attack or stroke, and asymptomatic carotid artery plaques has been observed. A strict classification in symptomatic and asymptomatic carotid stenosis, and decisions on the degree of carotid stenosis alone could be misleading. The need for a more comprehensive and personalized risk assessment tool is clear. Such a tool may offer deeper insights into individual patient risks and help identify high-risk asymptomatic patients.
The TAXINOMISIS project has produced two very important tools. The first one is a software, is a platform which is related to the risk stratification, and it's called the risk stratification platform. For this one, we have several approaches, from AI risk stratification, first level, on the second level using plaque flow simulations to detect and understand plaque rupture, and on the third level, we have built plaque growth models. Having all those approaches, initially the patient can be stratified, and then we can decide about the treatment interventions. In that way, it provides a very powerful tool for healthcare professionals in order to treat on a personalized manner the patients with carotid artery disease, being symptomatic or asymptomatic, which is also a very important contribution of the project.
The TAXINOMISIS risk stratification tool is designed as a user-friendly, cloud-based platform addressing this need. Risk assessment is provided using machine learning algorithms, computational fluid dynamics, and predictive modeling. TAXINOMISIS platform input considers various data such as personal information, blood exams, medication, and imaging data. These data have been collected by the 6 participating clinical centers. The recruitment of 345 patients was achieved, considering 3 follow-up visits at 12, 24, and 36 months. This approach aims to provide new knowledge on the identified gaps of the standard of care. The first level of the TAXINOMISIS platform utilizes cutting-edge machine learning algorithms. Extensive datasets of patient information have been analyzed. By identifying patterns, the platform can predict more accurately an individual's risk of carotid artery disease. The second level of the platform leverages the power of computational fluid dynamics to simulate blood flow. The calculation of wall shear stress enhances the understanding of the mechanical forces contributing to plaque buildup. The third level of the platform uses computational models to simulate the progression of plaque over time. This predictive capability allows clinicians to forecast future plaque growth. Also, patients who are at high risk of developing severe disease can be identified. When there are no major symptoms, medical drug treatment may be sufficient to avoid stroke and transient ischemic attack. There are different medications that can be prescribed. The patient genotype can determine the best treatment due to the significant interpatient variability in drug response. In the TAXINOMISIS project, a microfluidic chip device was designed, fabricated, and tested. 13 different single nucleotide polymorphisms were detected, which are relevant for patient treatment.
The second tool is a lab-on-chip. This lab-on-chip can detect accurately in very little time and also in a very effective way SNPs which are related to the disease. Having those SNPs, we can understand and assess the risk, and also we can understand the treatment options that we have, and those can be implemented in a risk stratification approach like the taxonomist project.
The single nucleotide polymorphisms detection is based on quantitative polymerase chain reaction. As proof of concept, 3 different DNA samples were tested. The results were compared with the benchtop quantitative polymerase chain reaction tool for validation. A new loading concept was tested. All quantitative polymerase chain reaction reagents were loaded in the chip in less than 10 seconds. There was no need of external fluidic peripherals or multiple pipetting steps. The chip is made on a silicon substrate. It contains an inlet port, 22 reaction chambers, and a channel to distribute reagents to all the cavities by capillary flow. TAXINOMISIS provides a novel, comprehensive and personalized risk assessment for carotid artery disease. More effective and early interventions are targeted. Enhanced risk assessment. High-risk asymptomatic patients can be identified who are often overlooked in traditional clinical workflows. The early identification can lead to preventative measures and early treatment improving, thus patient outcomes. Support for asymptomatic patients. By providing a detailed view of a patient's condition and risk, TAXINOMISIS supports significantly and improves the clinical practice. Thanks to the TAXINOMISIS platform, more informed decisions can be made about prevention and treatment strategies. Additionally, the TAXINOMISIS lab on a chip has several advantages compared to a commercial benchtop tool. The reaction speed and the reagents consumption are lower. Single nucleotide polymorphisms detection can be performed outside centralized laboratories. Improved clinical decision-making and treatment. By identifying the high-risk patients and intervening early, it could lead to significant cost savings in the long term. Serious complications can be prevented, allowing to reduce intensive treatment needs and limit the financial burden to the healthcare system.